Today I have my third interviewee, and I would just like her to introduce herself first. Just your name, your position, and a brief description and background as to what you do in the community.
Oh, absolutely. Very, very proud to be here first and foremost. My name is Michelle Gilchrist, and I'm the president and CEO of Bloomington Health Foundation. What we do in the community is we provide financial support to affect change as relates to improving the health outcomes in our community and the surrounding area. My background in particular, I was born and raised in Kansas City, Missouri, moved to Memphis, Tennessee in the early 90s. Spent most of my career there, going up through the United Way system as well as the UT University of Tennessee Health Sciences, and then made my way here from National Foundation for Transplant. So I've actually worked in nonprofit for quite a while, but the passion that I have for what we are talking about today really stems from being rooted in Memphis, Tennessee, a very historic place with the civil rights era, and being reminded often and trying to affect change as relates to equity, diversity, inclusion, and just really trying to live out what Dr. King and the civil rights movement stood for.
Awesome. So I'm not very familiar with the Bloomington Health Foundation. So if you could, what exactly does the Bloomington Health Foundation do for the Bloomington community?
So, what does the Bloomington Health Foundation do for Bloomington? We do quite a bit. We've been around for just over 50 years. We were founded as Bloomington Hospital Foundation by the local Council of Women. At one point, we were the fundraising arm to the now Indiana University Bloomington Hospital. But since 2021, the end of the year, we formally separated from the hospital. We changed our name in 2018 to Bloomington Health Foundation. Our role has changed also. So what we have done over the years is really to support the hospital and the needs of the hospital, but also to invest in the growth and expansion of healthcare in our community. So what it's done, for example, is we helped to support the creation and the building of the Stride Center. We led the efforts in raising the capital resources needed for the hospice house, which is definitely a much needed service in our community. We recently provided support to HealthNet through the non-emergency medical transit. They have a vehicle that will go out to the rural communities in order to provide different types of minor medical for those that don't have the transportation to get to the hospital. We also have invested in other things such as cancer support community. There was a huge population of cancer support needs here that when we saw the opportunity, we looked to Indianapolis Cancer Support Community and asked if they would consider creating a location here, and they agreed. We then, in partnership together, have funded the establishment of Cancer Support Community South Central Region, which is located on 3rd Street here in Bloomington. The impact of the work of Cancer Support Community is far greater than what we ourselves could do alone, and so it's necessary for us to play a major role in ensuring that it has the resources necessary to operate and provide those services of supported care services to cancer patients and their families. So the list goes on and on. We, even help with getting healthy foods to those that don't have the resources to go to the local, farmers market or any other major healthy store, because the cost of that's very expensive. But what we have done is we partnered with the Sante Foundation to create market bucks. So those that have SNAP or food programs, $1 at the market will be worth $3. They can have healthy food. So again, the list goes on and on. Not to talk all day about what we've done, but what we're most interested in doing is changing the health of the Bloomington and the surrounding area so that everyone, no matter where they come from, have access to adequate care, that they can trust that their medical needs are important to us, but more importantly, that we can facilitate, bring the right people around the table to facilitate positive change.
Awesome. I know you kind of briefly touched on this in your introduction, but what led you to your position as CEO of the Bloomington Health Foundation?
Actually, what led me to my position here was my research. So I'm currently a doctoral student at the University of Alabama in Birmingham, and I'm in the process of defending my dissertation or preparing to defend my dissertation. My dissertation is on social determinants of health, looking at social determinants and understanding what they are from a macro, micro level, but also its role in equity and health equity specifically, its role in, removing barriers, knowing what those barriers are, knowing how certain social conditions affect our ability to live a healthy lifestyle. And I give you an example of what I mean by that. If I live in a community where there is no transit from my home to the hospital, I don't own a car nor earn enough money to be able to catch an Uber or some other alternative source, there's a barrier. There's a barrier that isn't because I don't want to obtain healthy services. It's just I don't have access to that. Other examples, much like I mentioned earlier, has a lot to do with the food. If I can't get access to healthy foods because what's in my community are poor quality foods, then how am I being held responsible for the outcomes of poor health conditions when the alternative to having healthier conditions aren't made available to me? And so for me, looking at the research and what social determinants of health means and being able to examine it more comprehensively and then look at it from a different paradigm so that we can use what we know about determinants to change the system that make those determinants possible. Now, some things are just our own behaviors and being able to isolate things that are not necessarily what I do, smoking, drinking, etc., but things that others or things have done to me, decisions made for me, access to health literacy, things that are not within my control. So what led me to the Bloomington Health Foundation is its interest in examining and exploring and changing how we utilize and view social determinants of health.
Awesome. So since you work with like a health foundation, how has COVID impacted the mission of the Bloomington Health Foundation and everything that you do?
COVID, so how has COVID helped impact our mission? That's a really interesting question. So on the one hand, COVID for sure has changed the health system all across the country, in fact, globally. But as an organization, how it impacted our mission, it allowed us to live out our mission. So when COVID occurred, we led an effort to facilitate how do we get access to the vaccines or to get testing, etc. We stayed informed through a large committee of other community leaders and ensured that we met as leaders of the community regularly to make sure we understood what was happening in our community so that we can affect change. So COVID, while it itself is not a virus that we're wanting to be here, it's one that is here. But from a mission standpoint, it allowed us to collaborate with other community leaders. It allowed us to use our resources to invest in access to the treatment that was needed, distributing, PPE products. It allowed us to work with our government officials. So it allowed us to really live out our mission and to understand that everybody should be entitled to have access to those resources.
Awesome. So finally, what does the MLK's legacy mean to you and the work that you do in the community?
So what does MLK Legacy mean for me personally and my work? So from a personal standpoint, one of the things that I am constantly reminded of about Dr. King is how he encountered so much adversity in a period in time which it wasn't common for an African American, or in his case, an African American who was educated, to be able to change complex systems. But yet and still, he understood that he couldn't do it alone. And so for me, I look at him and his understanding that it takes all of us to make the kind of change that we want to see. And so for me here at Bloomington Health Foundation and our organization, we're very much interested in collaborating with others, understanding that there's no one right answer, that we can't pursue or obtain positive change if we don't first understand how to work together. And we have to have a shared vision of what is possible, work towards that objective, and then be able to leave a better community than what we inherited. And so I think for Dr. King, his understanding that his hard work and his efforts and the efforts of all those that were part of the civil rights movement, that they understood very clearly that it required them to make huge sacrifices. It required them to be persistent and not to lose hope, and to stay the course despite the obstacles and adversity that they faced, because what their work will ultimately result in are the changes that we see today. If it wasn't for those sacrifices, we wouldn't have diversity in schools. We wouldn't have the opportunity to obtain employment. You would still have a lot of negative perceptions of humanity. And so he tore down those barriers. And for us as an organization, we want to make sure that we make it possible for the low income all the way up to those that have income to have access to treatment and care, and that the quality of that care is one that each of us can be proud of. So again, for me personally, I admire the work of Dr. King. I admire the fact that I had the privilege while working in Memphis and living in Memphis, Tennessee, before coming to Bloomington, to have played a small role in restoring the Claiborne Temple, but then also to be able to have been a part of that community where his assassination took place, and to be able to raise children that understand that it is about diversity, it is about being fair, being honest, and working towards a common good.
Awesome. So thank you so much for sitting with me these past few minutes and just answering some questions. And I thank you for your time.
Absolutely. It's my pleasure. And I'm very glad that you guys are doing this for the community. So please let me know if there's anything else that I can help you with.
Awesome. Thank you so much.